Hello, this is U.S. Congressman Alex Mooney. Thank you for joining my live telephone town hall discussion this evening. It's an honor to represent you in Congress. I'm calling you right now live from Washington, D.C. in my Rayburn House office building, really your 2nd District Rayburn House office building on the 4th floor of Rayburn. If you're on this call, you're in one of the 17 beautiful counties that I'm blessed to be able to represent in the 2nd District of West Virginia. The district, if you're not familiar with it, stretches from the Potomac River all the way to the Ohio River, includes Kanawha County, Jackson, Putnam, Clay, Calhoun, Wirt, Roane, Braxton, Lewis, Upshur, Randolph, Hardy, Hampshire, Pendleton, Morgan, Berkeley, and Jefferson counties, which is where I live with my 3 children. So thank you for joining me today. Again, this is Congressman Alex Mooney, live telephone town hall meeting this evening. I'm eager to hear feedback from you, the constituents that I represent, about issues facing you and your family, and give you an update on the important issues we're addressing in Washington, including creating West Virginia jobs and the federal government's response to the coronavirus epidemic. Today I'm joined by West Virginia University Medicine's pediatric infectious disease expert, Dr. Kathryn Moffett. We look forward to answering your questions during this telephone town hall discussion. If you would like to ask a question, I would like to hear from you. So press star 3 on your phone at any time if you have a question and would like to get into the question queue. Again, this is U.S. Congressman Alex Mooney, and you are currently joining my live telephone town hall meeting. Amid the COVID-19 pandemic, I've been working hard in Congress in close collaboration with the Trump administration to make sure West Virginians have access to critical resources for testing, treatment, prevention, and recovery. I've worked with President Trump and Congress to pass the Coronavirus Aid, Relief, and Economic Security, called CARES Act, to bolster our healthcare system and provide economic support to small businesses and individual Americans. That bill passed Congress with a vote of over 400 yes votes and only 4 no votes. So for all you might read in the press about Republicans and Democrats disagreeing and arguing, we do work together sometimes and pass bills either unanimously or nearly unanimously. This week we just passed our water bill dealing with water usage authorization by voice vote, which means nobody objected. It was unanimous. So I wish you'd hear more about that in the news than you do. But we are working together where we can and with the president, but we also disagree on issues, and that comes out as well. But funding in this legislation that passed, the CARES Act, also goes to rural hospitals and healthcare providers for support in the fight against the coronavirus. The Department of Health and Human Services awarded $22.1 million in CARES Act funding to 28 health centers across West Virginia. $4.4 million in CARES Act funding were recently announced to boost economic development programs critical to helping West Virginia respond to the coronavirus. Due to the CARES Act, the Small Business Administration has issued over $1.7 billion in loans to over 137,365 West Virginia small businesses. That's a big number. Our state budget for state operating funds is $4 billion. So $1.7 billion in loans to West Virginia small businesses is quite a large amount. These loans are designed to keep people employed during the crisis and prevent small businesses from closing permanently. Additionally, as our country continues to wrestle with the COVID-19 pandemic, our elderly citizens should still be able to access routine care. That's why I recently co-sponsored a legislation called the Emergency COVID Telehealth Response Act, which would improve access to healthcare services in rural communities. I would like to hear from you. Please press star 3 if you have a question to get into the question queue. Press star 3 anytime if you have a question. As I'm a member of the United States Committee on Financial Services, at a hearing just last week, I asked Dr. Stephen Davis from the University of Chicago Booth School of Business a question about incentives to get back to work and how to incentivize back-to-work bonuses rather than additional unemployment, getting paid not to work. Had a number of meetings with businesses throughout West Virginia's 2nd Congressional District, and businesses, basically every meeting I've had with businesses in our state, small and large, have expressed concerns about getting folks back to work. They're having a hard time getting folks to come back into the office and start working. It's a constant concern. So Dr. Davis said regarding this back to work bonus, it's one of the many ways to help workers, families, encouraging work and not discouraging work. So I'm going to continue to focus on bringing jobs back to West Virginia. Again, this is U.S. Congressman Alex Mooney, and you are currently joining my live telephone town hall meeting. Please press star 3 to get in the question queue and talk live on the line with me. Press star 3 at any time. We can all continue to do our part to reduce the risk of spreading the virus in our community. Nationwide, testing equipment is now readily available with more rapid results. When this coronavirus first started, it was as long as 4 days to get the results, and then it was 2, then it was 1. Now they have this rapid testing. I actually got tested myself because I was in the area where the President of the United States was on July 3rd, and the results were within half an hour. So you have good rapid tests available. If you think you're experiencing symptoms of the coronavirus, please contact your healthcare provider. Not everyone, if you don't have the symptoms, they don't want you to get tested because we don't need to test every person in the country. There's certain standards for that, and our doctor on the line can get more into that. If anybody has any questions, Dr. Moffett could answer that. So while the coronavirus has certainly dominated the headlines, there is other important work taking place on your behalf in Washington. I'm working on legislation that will help West Virginia. And again, everywhere I travel, I hear about the importance of fixing our West Virginia roads and bridges, ensuring proper functioning of our infrastructure, working to complete the final stretch of Corridor H, that beautiful road right through the middle of our state, which helps a lot with jobs in the economy, job growth, to have a nice highway to go through the middle of our state so you can connect to Virginia from Ohio. I am pleased to announce a $12 million U.S. Department of Transportation grant that will fund infrastructure improvements on Corridor H. We are just one phase away of finally completing that important road. This is great news for the people of West Virginia. It'll help create jobs and fuel our economy. I also introduced the Aid in Appalachia Act to provide Appalachian states like West Virginia with increased flexibility and funding for projects like Corridor H. In West Virginia, this highway will allow for more private industry jobs to be created. My bill, the Aid in Appalachia Act, was actually added as an amendment and passed in the committee to the Congress's recent recent infrastructure bill, rather. It was actually added as an amendment successfully. I worked with Congresswoman Carol Miller, also from West Virginia, to get that in there. The amendment, unfortunately, was taken out by a member on the House floor. There actually was the person that actually offered the amendment by proxy, and a lot of proxy folks voted by proxy, and unfortunately, it was not passed in the final version. And that's a whole other issue about voting by proxy. I think members of Congress, if they're going to vote and represent their constituents, need to physically be here in Washington, D.C. to vote, not home voting by proxy. But Congress has never done that before. So if you're not following this, never in the history of America has members of the U.S. House of Representatives stayed home and given their vote to somebody else to vote by proxy. And I think that's a very bad way to conduct government. I also don't think it's constitutional. But since 1965, the West Virginia congressional delegation, both Republicans and Democrats, have been working to complete this road, Corridor H, and and I'll continue to fight for that. Going forward, I think there's lots of opportunities to get that road completed. Again, this is U.S. Congressman Alex Mooney, and you're currently joining my live telephone town hall meeting. Please press star 3 at any time to get in the question queue. Please press star 3 to get into the question queue. The accuracy one is good. I'm proud to also be a co-sponsor of the Life Now Act, which would prevent taxpayer dollars from funding abortions. Providers under the Paycheck Protection Program. Congress created this loan program for struggling small businesses forced to close down due to the coronavirus, no fault of their own. But I want to ensure your taxpayer dollars do not go to fund abortions. I'm pro-life, and we must never grow weary in the sanctity of defending all human life. Again, this is U.S. Congressman Alex Mooney, and you're currently joining my live telephone town hall meeting. Press star 3 to get in the question queue. Press star 3 at any time to get in the question queue. I'm also proud to protect your Second Amendment rights. In late June, there's been a lot of headlines continuing going on this issue, but in late June, a St. Louis, Missouri couple practiced their Second Amendment rights to defend themselves and their property against trespassing protesters. Recently, the couple was criminally charged and their firearms seized. In response to this action taken against the St. Louis couple, I, with several other members of Congress, sent a letter to the United States Attorney General Barr urging him to take decisive action to uphold the rule of law and protect the rights of citizens to defend their homes, their personal safety, their lives, and their businesses. I've also co-sponsored the American Family and Private Property Defense Act. This legislation prevents a U.S. citizen from being prosecuted under federal law for the use of force against an intruder as long as that force was used to protect themselves or another individual or private property. It's important. I recently met with the police in Putnam County just last month, had a very informative meeting with police chiefs in Putnam County, and it's important we continue to support our brave police officers during this time. I've had productive conversations. I look forward to working with local and federal officials to secure the resources needed to keep our communities safe and healthy. Again, this is U.S. Congressman Alex Mooney, and you're currently joining my live telephone town hall meeting. You may press star 3 at any time during this telephone town hall hour to get into the question queue, star 3 at any time. So now I'm going to go on and introduce our special guest, and I'm really thankful that Doctor could join us. I'm proud to introduce our distinguished guest, Dr. Moffett, Kathryn Moffett. She's a practicing pediatric infectious disease expert from West Virginia University Medicine. Through over 2 decades at WVU, West Virginia, she's been passionate about caring for patients with infectious diseases and cystic fibrosis. At WVU, she built a cystic fibrosis center focused on patient care, teamwork, quality improvement, and research. So at this point, I will turn it over to Dr. Moffett for her opening remarks, after which we open up for questions. Dr. Moffett, please go ahead.
Yeah, thank you, Congressman Mooney, and it's a pleasure to be here. So I welcome everyone over the phone lines, and thank you for inviting me. So, yeah, I'm an infectious disease specialist. I do pediatrics. So how has COVID-19 impacted me and kids? Well, we know that this pandemic has impacted all of us. And although we have only had 2 children admitted to Ruby Hospital, our WVU Medicine Children's Hospital at Ruby, we've been impacted a lot by this. We all did a shutdown. We closed clinics. Everybody was home. Some of us, like I've been at work every day, despite all that, but we've worked on guidelines and practices and ways to the process of getting in to see providers, and then we've opened back up. And so I think, medical offices are back open in a different way, but in a safe way. And now we have lots of questions about how we manage living with COVID. How much more do we open up or stay closed? Those are questions. And then what do we do about schools? So I'll give you one more two more comments, and then I want to open it up because I think you all have questions. And so one thing that's interesting is this is data that is collected in the United States. Is out of all the 145,000 cases of COVID that were diagnosed through April. So I know it's a little old data, but out of those, 1.7% were children, but children make up 22% of the U.S. population. So the question is, children are not getting diagnosed maybe, or they're not getting infection, they're not getting severe infection, maybe that they're not severe enough to be tested. I think we have better testing and available testing now. But children clearly are not being admitted to the hospital because they're not so sick. And then the other thing that, you mentioned at the beginning, Congressman Mooney, about routine health care. No one should put off their routine health care. We saw a drop-off in not just clinic visits, but admissions to the hospital with disease that normally would be coming here. And then when we started opening up, we got really overwhelmed with people who were extremely ill. So we should not be putting off your heart disease, your gallbladder, your GI disease, your evaluations for all these things that you should be doing. And children have not been getting their routine well child checks and vaccines. and that's really critically important. So I'll stop there, and then let's have a discussion. Let's take some questions.
Okay, thank you very much, Dr. Moffett. That's very, very helpful. I think the first couple questions in the queue do relate to the COVID virus. And again, this is Congressman Alex Mooney. You're joining our live telephone town hall meeting. Press *3 at any time during this telephone town hall to get in the question queue, *3. Our first question is Braxton County, and I think Randall is on the line. Randall, if you're with us, go ahead, sir.
Yes, sir. Thank you. I would just like to know what steps have been implemented on the subject of accurate counts of who has the virus, how many has the virus, and everything else. Because this seems like it's been politicized with one side saying higher cases of COVID than the other side, to use it against Republicans and Democrats. I mean, who what steps, to get accurate counts of who actually has died, has got it, and everything else. What steps have been implemented to stop situations like that?
Well, I know. So thank you, Randall, for your call. I know there was concern, and our health officer resigned a month or so ago. We now have a new health officer in West Virginia. I don't know all the details that were involved in that, but I do know that our public health system is working overtime to make sure our numbers are accurate. So when we get positive tests, they're following up on each one of those. I know that in my area in northern West Virginia that's happening, and I've gotten phone calls of patients who I've diagnosed or who I've been involved with or my team has been involved with, our hospital's been involved with. So I agree with you. This should not be politicized at all. This needs to be accurate and correct. And our hospital and our health system works very hard at making sure these are reported by law. There's certain diseases. There's a list of diseases that are reported by law when we make a diagnosis, and COVID is one of them. And so we're all working together to make sure that that's accurate. And it makes me sad if someone is falsifying information, but I think we're working our part. We have a good system of our Department of Health and Human Services in West Virginia, and they're working really hard to make sure this is right.
Well, thank you. But would you just say generally, Dr. Moffett, the tests are accurate? If someone gets a test back and says,
Yeah, I think that the tests are accurate. So the PCR swab, which is the COVID swab of your nose or your mouth. Right. Some of them are doing mouth. Okay. They're very sensitive. And now there's the blood test looking at, do you have immunity antibodies from a recent infection? Right. And those are accurate. Yeah, okay. Those are accurate.
So you feel confident saying the tests are accurate. Well, that's good because folks want to know there's a lot of false information out there. Some people might second guess the test. But I've never heard any concern as a congressman in all the briefings I've been in, which has been many, many, many briefings, probably 50, and there's never been a complaint or a concern about the test being accurate. So if you're listening on this call, if you're tested negative, it's accurate. If you're tested positive, it's accurate. There's not a concern about that.
Right. So I'll tell you one thing about the test. So I'll give you an example. I work with a person who we diagnosed in March, and her test was positive, and it's by the PCR swab. And then she got tested again because at that time we were requiring you to have 2 negative swabs, PCR swabs, to come back to work. So she ended up having a total of 5 swabs over 6 weeks, and her last 2 of her 5 were negative. We're not requiring that anymore. And why are we not? Because we realize that after about 10 days from when you first develop symptoms, you're not contagious anymore. But that PCR swab finds pieces of dead virus that can hang around for a long time. So the PCR swab may still find some virus there, but you don't need to have 5 swabs anymore. If you are positive with number 1, you are positive, and then we go by your symptoms, your fever, how severe you are, and when we then determine you're no longer contagious. So I think that's been a confusion. Okay. How many do you need? You don't need the 2 negative anymore.
Gotcha. Okay, let's go to the next question. There's a lot in the question queue, and I appreciate your confirming that that information. So I know in about 2 weeks they say you 2 weeks before when you're clear anyway. So we have from Elkins in beautiful Randolph County, we have Arena on the phone. Go ahead, Arena.
Yes.
You're on.
Yes, I would like to know from Mr. Mooney a specific number. How much money will he support for national testing in the new bill? Because all I've heard is $14 billion from one party, and Secretary Mnuchin, who is proposing a budget which is completely inappropriate. He's not an elected congressman or senator. A piecemeal, which at this point doesn't have anything for testing. Yet the DOD is proposed to get another almost $30 billion for the contractors right after passing a defense appropriation bill for almost $800 billion. So it seems to me testing is priority to prevent tens of thousands of deaths in this country and return to an adapted, normal lifestyle and economy, and yet I don't see it as a priority with Congress. What would you specifically support for a number for testing in the United States?
Well, that's a great question. I'll tell you, the last bill that we voted on, the CARES Act, I referenced that in open remarks some. I know folks are joining the call as we go along. That bill was, the overall price tag was about $1 trillion, over $1 trillion, $1 trillion for everything in there. And that was Paycheck Protection Program, unemployment, stimulus checks. It was a lot. And I did vote for that. And there's another caller on here. I won't have time to get all the calls, but again, press *3 if you want to get in the question queue. A lot of good questions. But one of the callers asked, how did I vote on the CARES Act? I voted yes. I voted for the CARES Act. We were in an urgent situation. A lot of funding for, I don't have the right numbers exactly in front of me. Let's see if we have that as far as the actual money that went to the hospitals and to the testing. But it was billions. It's many billions. And it's hard to give an exact number. I mean, I voted for $1 trillion. I hope to not have to vote for $1 trillion again, to be perfectly honest with you, because these are not paid for. We're borrowing the money. In many cases, we're borrowing the money from debts and bonds that are sold internationally, China and Russia. So I think we need to get back to actually paying for things that we do. But actually, we do. I'm going to do 3 poll questions on this call. Let me go ahead and ask the first one now because I want to hear your input on these questions. So, and you've pressed 1 on your keypad to answer yes, and 2 on your keypad to answer no. Again, press 1 to answer yes, press 2 to answer no. The question is, congressional leaders are proposing another coronavirus relief package that will cost over $1 trillion. Do you think Congress should add to our national debt by passing this bill? So the answer, 1, yes, we should pass the $1 trillion, and 2, no, we shouldn't add to our debt by doing that. Traditionally, there's a expectation that we have a way to pay for bills that we pass. So we don't have a balanced budget amendment here. We pass balanced budget laws, and ideally, if you're going to spend on the military, you're going to spend on hospitals, whatever, transportation. Most states have balanced budget amendments. Most families have to balance their budget, and there is a concern that we're spending. We spent, I think, already over $3 trillion is the number. Arena from the last call asked a great question: how much can you spend? And I think, Arena, really to answer your question fairly, we have to take into account what we've already spent. And there's been 4 bills, not 1, not 2, not 3, but 4 bills that have passed. And I voted for 3 of them. I didn't vote for one of them because they didn't even put a spending price on it, the second one. But the The last one, which was huge, and a lot of money went to hospitals and research. It's been very, very fast. The tests have gotten more quick and more accurate. So again, press 1 on your keypad if the answer is yes. The congressional leaders proposing another coronavirus relief package would cost over $1 trillion. Do you think Congress should add this to our national debt by passing the bill? 1 for yes, 2 for no. Let's go ahead and go to the next question. We'll stay with the medical. This one, this will be Clay County. And Brian, if you're with us, Brian in Clay County, go ahead, sir.
Yes, sir. Thanks for taking my call. As I spoke with Screen, I explained hydroxychloroquine is, with the azithromycin pack, has been under controversy with medical experts on both sides coming out for it and against it. I know in some states that pharmacy boards have unilaterally forbidden doctors to provide it off script when it is used as a prophylactic and or to help someone who has contracted the coronavirus. Your thoughts on this? Because a lot of the doctors that are coming out for it are actually treating patients, seeing the results in real time, well over 300 patients, some of them, and I know Dr. Fauci is an infectious disease expert, but he hasn't seen a patient in over 30 years. So I was wondering your thoughts on it, and if there's anything in West Virginia that would prohibit a physician from prescribing this as even a prophylactic if necessary.
So there's no restriction on anyone in West Virginia to prescribe azithromycin or hydroxychloroquine. It is a controversy, and we try to do things in medicine that have evidence, and we call it peer-reviewed. So what that means is that a study is done, hopefully unbiased, meaning without not with the company who makes the drug behind it wanting the results to be favorable, but we try to do a study in that way, and then have experts who are scientists to look at the study and see how well it was done. And so we have evidence for many of these drugs already that people have been really working hard in clinical trials to try and answer the questions of how well these drugs work. And so far there isn't evidence that points to the benefit of either hydroxychloroquine or azithromycin, and there's perhaps some detriment. People get heart arrhythmias from chloroquine. So these are really what's been disproven.
The study that came out about the arrhythmia, that there has been no justified cases. They even had to pull back that study because it was a faulty study. And the fact that hydroxychloroquine has been on the market for, I believe, 70 years, that, if there is a positive possible, even if it's questionable as to the extent of it, the fact that the chance for harm is so minuscule that it would not be tried, why it should not be tried, and that some physicians have, more politicians than physicians have come out saying that it's had negative effects. But the one study that did come out against it they had to actually recall that study because it was so faulty.
Well, I think this is what we need to look at it with very subjective eyes and look at the science behind it. So, yeah, hydroxychloroquine has been available for a long time, and it is known that one of the potential side effects of anyone, non-COVID, of being on it, used for rheumatologic diseases, for malaria, is that you can get an arrhythmia. So those are known side effects. So I think that we have to look at this and try and put our politics aside, our biases aside, and look at let let the scientists and the physicians do medicine in a way without the media and politics getting an opinion before the science actually decides how well it works or not. So there are not limits in West Virginia on what physicians can do, but I think that the physicians in our state have looked at what the evidence is, and we are offering the best evidence and care is for our patients with COVID.
All right, thank you, Dr. Moffett. Again, if you're just joining, you're on with Congressman Alex Mooney. You're in one of the 17 beautiful counties I'm blessed to represent in the 2nd West Virginia Congressional District. I'm calling you from Washington, D.C. right now, where we're voting on these issues and have been for the last 2 weeks. We're on with Dr. Kathryn Moffett, an infectious disease expert at West Virginia University. We do have a couple other questions. You can press *3 on your phone at any time to get in the question queue to ask a question. Again, you may press *3 on your phone to get to the question queue. We're already a little more than halfway through our hour here. There are 2 other questions. I'll ask them for the folks on there just for the interest of time. Dr. Moffett, related to hydroxychloroquine, one question from Daniel in Jackson County is simply, I'm going to ask these both and you can answer them both at the same time, is how do you get hydroxychloroquine to the people who need it? And Connie in Braxton County wants to know if the hydro drug will be available if someone tests positive.
So the drug is available. I think you talk to your physician if they think it's reasonable or warranted that there's a reason why you would need to be on it. And we don't have any limitations really on any of these medicines that have been shown to be helpful for COVID. Remdesivir, the steroids that we use, all of this, the plasma, the serum, we're part of all of the network of being able to get these for patients with COVID. And our state has been very helpful, the state health department, in making sure we have access.
Okay. So let's go to the next question. We have, it's from Martinsburg. I don't get the person's name. I guess it's Brian. Brian, go ahead.
Good evening. I want to thanks for taking my call. There's been a lot of information that's been floated out there concerning about our children and the wearing of masks and so forth. And I know that there are a lot of things that the body expels, and one of the things is sometimes is a bacteria, and we don't want that mask to prevent the air from coming out of a child or an adult for that fact. And I was just curious if Dr. Moffett has any information about our children and the harm that is from wearing a mask constantly, especially now that they're considering sending them back to school.
So I think we need to look at several aspects of wearing a mask. So people have done studies looking at what happens to your oxygen level, it's called your saturation, when you wear a mask, because people have concerns that their oxygen sats would drop. And nice studies showing that people's oxygen saturation stay normal. Same with the carbon dioxide. You breathe out, you breathe in oxygen, you breathe out carbon dioxide. You do not retain carbon dioxide in your mask. So your carbon dioxide comes out through your mask. Now, as far as bacteria, so we all have normal bacteria that live in our mouth, our throat, our nose, even our GI tract, our skin. So a mask should be washed, because just like clothing we wear, we would change our clothing, our underwear, and wash. So children should have options of good-fitting, child-appropriate size masks, and then if they get wet or soiled, I think that makes sense. You change your mask. But I have many patients who have very advanced lung disease with cystic fibrosis. They have immunodeficiencies that they're born with or acquired, and they wear masks for years when they're out in public and they come into the health care system to protect them, and they're able to wear masks. So children are able to wear masks as well. I have very young children who wear masks. They need to be clean masks. They shouldn't be wearing the same mask all day, every day for a week. We should be changing them out. But I don't think we should fear that a child is going to get sick from their own mask. We're trying to protect them from other people, their germs from passing to others and other people's germs from coming to them. So they don't breathe in someone else's germs, so they won't get sick. We actually have a theory. We will see, maybe we're going to see a real drop in flu, colds, strep throat, maybe even viral meningitis, which is a late summer, fall virus, because if kids are and teachers and we are all wearing masks, we're not going to share those other germs. And we actually may see a little healthier winter. I mean, we don't know what will happen, but maybe we will because of keeping our germs to ourselves and not giving them to other people.
All right, thank you, Dr. Moffett. Before the next question, I do have another poll question. Thank you for answering again. This is a three-part poll question. So you press 1, 2, and 3 will be what you'll press on your phone. 1, 2, or 3, and I'll read the question. Many want to see the economy reopen so Americans can start getting back to work, but a lot of people are concerned about their safety during this coronavirus pandemic. Which of these answers comes closest to your own view? So press 1 on your phone for the first, 2 for the second, 3 for the third. The first would be the health risks are manageable. Find a way to reopen our economy as fast as possible. That's number 1 on your phone. Number 2, the current closures are about right, where many people stay home and safe while some go to work. Number 3, for health reasons, we need to close the economy down even further until there's a vaccine, which could be over a year away. So 1, 2, or 3 on your phone. Press 1, 2, or 3. Again, I'll reread the whole question and the answers. And it's good to hear your feedback, so I know what you're thinking as I have to vote. Again, the question is, many people want to see the coronavirus, want to see the economy reopen so Americans can start getting back to work. But a lot of people are concerned about their safety during this coronavirus. Which of these answers comes closest to your own view? 1, press number 1. The health risks are manageable. Find a way to reopen our economy as fast as possible. That's press number 1. Number 2, press number 2 if you believe the current closures are about right, where many people stay home and safe while some go to work. Press 3 if for health reasons if you think that for health reasons we need to close the economy down even further until there is a vaccine, which could be over a year away. Those are the 3 options. Again, this is Congressman Alex Mooney, our live telephone town hall meeting. Press star 3 at any time to get in the question queue. Star 3 to get in the question queue. Thank you so much for joining. We'll go to Doug in Randolph County now. Doug, go ahead.
Thanks for taking my call. I just want to say, first of all, I think the survey questions are a little bit leading. I think that there are more nuanced options that are available, particularly with the last one. Some of us believe that we should close down for 2 weeks and let the infection, people who are currently infectious, let that run its course and then open up in a more aggressive way, not waiting for a vaccine. And that ties into my other question, which is, how can we safely open schools, just elementary schools, public schools, up through institutions of higher ed?
That's a good question. We have a lot of questions about schools, so Dr. Moffett, go ahead on that one. Thank you, sir.
Thank you, Doug. So there was a recent study that was just published from South Korea, and they looked at over 52,000 patients with COVID-19, and a bunch of those were kids. And they looked at under 19, and they looked at those children transmitting COVID. And what they found was that under 10, children really didn't transmit infection very much. And 10 and up, they did just like adults did. So what that I think is some guidance for us to say, the elementary, the preschool and young school-aged, elementary-age kids probably, some will get sick, but they're not going to be probably a driver of a lot of transmission. But I do have concerns that then the older, the middle school and high school, and then older adult, can transmit just as easily as any of us can. So this is the question, how do we safely open and be safe with lots of hand washing and masks? I believe we have 2 simple measures, right? 3 really three simple measures. And we want a cure, we want a vaccine, we want better drugs. I want that. But the simple measures are that we wear a mask to keep our germs away, others' germs from me. It's a respect I have for anyone I'm around, and a respect for me that people wear masks. We wash our hands. We keep it off our hands. So when we take our mask off, the COVID-19 is not on our hands. The SARS-CoV-2 virus, to give us COVID, is not on our hands. And then the third is the social distancing, to be away so if you're sneezing, coughing, you're not giving it to someone. Are we able to achieve that in school? And I think that our superintendent, Birch, I was on a call with him last week, is trying very hard to look at what options are. Every county is a little different. Your counties are all very different than my county right now. Mon County, it went from red to orange. I think we're yellow now. But we still have a higher rate of COVID-19 than anywhere else in West Virginia right now. And we want that to go down to white. We want that yellow to go to white. You all do. So in your counties where there is not a lot of COVID, opening at least elementary and maybe middle schools may be able to be safely done. But if there is a lot of infection around, then is that so safe to do for our children and for our teachers and all the staff and the bus drivers and everyone else at school? And those are tough.
All right. Thank you, Dr. Moffett. A quick follow-up to that. There's on Berkeley County. No, it's Morgan County. Harold from Morgan County. Harold, I'm just going to read your question for time purposes. He wanted to know if there's any information about when a vaccine will actually be available.
Yeah. So thank you, Harold, for asking that. There's more and more stuff in the news. I just read this morning about the messenger RNA virus that they did some tests in primates, non-human primates, and had a really good response. We want to know a vaccine's safe before we give it to people. I think that's encouraging data on that vaccine. And when's it going to move a little closer to giving it to people? And then there's some other vaccines that are being made in a little different way. We've never had a coronavirus vaccine. Coronavirus causes the cold. There hasn't really been a need, but people did look at the SARS and MERS. Remember those two first coronaviruses that were in the early 2000s that caused outbreaks and were contained in the world. And then I think the work stopped because they contained the virus. So I think it's probably months to half a year away till we really see some data of clinical trials in people, and then maybe expanded to a bigger group of people. And then the big question is going to be the production of enough virus vaccine, not production of the virus, but production of vaccines so that we can give it to people. So it's coming, and there are lots and lots of really smart people collaborating, working in not just in the U.S., North America, Europe, worldwide, to share the science and do this in a safe manner. But that's what I can tell you, and I wish it was more.
Thank you, Dr. Moffett. And then while we're on the issue of schools and possibly opening, I just do want to mention for the listeners, I'm a co-sponsor just recently here of House Resolution 7710. This would provide liability/lawsuit protection to our schools in West Virginia so they can reopen during the coronavirus scare that we have here. The bill will provide schools and universities with the legal protection they need to reopen and begin the process of getting back to normal for parents, teachers, and students. So let's go ahead. Let's go ahead to another question. Again, this is Congressman Alex Mooney, Dr. Kathy Moffett, on our telephone town hall. And thank you so much, Dr. Moffett, for joining us. And again, press *3 to get in your question queue and ask a question for me, Congressman Mooney. And we'll go to Gary in Martinsburg. Gary, go ahead. You're on the line.
Yes, Congressman. Thanks for taking the call.
Sure.
Mine is a little different than the actual coronavirus, but I think it's probably can be attributed to the fact that everybody is staying home, and that is all the we've got 20 major cities that are experienced or have experienced mob disorder, riots, private property destruction, and all. And my concern is that the way it's going, we could be going into another civil war here, not necessarily state against state, but neighbor against neighbor. And I'm looking to you to kind of address what can or what will or what is Congress doing to help reestablish the rule of law.
So thank you. I tell you, my mother, for those who don't know me, my mother fled a communist country. And, people come to this country looking for the law to be applied fairly to everyone, regardless of race, religion, color, or creed. And, the law should apply fairly to everyone. So, in the tragic case of the killing of George Floyd, that police officer is being charged with homicide, and he's going to go before a jury, and he's probably going to get convicted. So the rule of law is applying there. Likewise, if rioters want to destroy things, I think the law should be applied there too. I'm all for peaceful protesting. Like this country, it's a beautiful place. Unlike these communist countries, like the country my mother fled, Cuba, and Russia, and these communist places where the government is tyrannical, we have freedom of press, freedom of speech, freedom of assembly. We have freedoms to peacefully protest, and I cherish and respect that. But when rioters want to come and take advantage of that situation, start burning things down, attacking federal buildings, smashing stores, the law should apply to them also. We cannot selectively apply the law. So I'm a strong supporter of that, and I think the president has taken a very strong stand, and I applaud him for doing so. So that actually does lead to my next question as well. And Gary, go ahead, Gary.
Yeah, I'm going to say a follow-up, if you will. I know in a lot of cases these riders are getting free passes on the destruction they've done, and that only, in my opinion, it only empowers them to continue what they're doing. There's no consequences. And like I say, I see it getting out of hand. I mean, 20 cities right now have either had riots or still having riots. We need to get back to law and order.
Amen to that. Thank you. And I mentioned in my earlier my opening comments about the couple in St. Louis, Missouri, who wielded firearms to defend their property, and from what I read, even potentially damage in themselves. I'm a co-sponsor of House Resolution 7716. I just co-sponsored that. The American Family and Private Property Defense Act prevents a U.S. citizen from being prosecuted under federal law for the use of force against an intruder when they're protecting themselves or their private property. I thought this was necessary given the McCloskey case in St. Louis, where a prosecutor charged a law-abiding couple with felonies for protecting their home against rioters. I think that's been pretty well reported on. So my last poll question of this telephone town hall will be your views on that, all the listeners, and sort of so related. Do you believe that the couple in St. Louis should be prosecuted for defending their homes from trespassing protesters? 1, yes, prosecute them. 2, no, they should not be prosecuted. Simple question. You can press yes on your phone if you think the St. Louis couple should be prosecuted for using their Second Amendment, wielding firearms in defense of trespassing, or 2, press 2 if you think no, they should not be prosecuted for what they did. So, again, thank you for that question, and I think we might have time for one more. Again, this is Congressman Alex Mooney, and represent the 17 counties throughout the 2nd Congressional District, and Dr. Kathryn Moffett has been great to assist us from West Virginia University with many of the with many of the medical questions. Let's go ahead and do one more, and then let's see how we look from there. But we have Betty in Kanawha County. Betty, if you're with us, go ahead.
Well, thank you so much for taking my call. When a vaccination is developed for this COVID, is it going to be required that all school-age children take it? And the health workers and all that? I mean, we're talking about freedoms, and some people may not want to. Some people choose not to take the flu vaccine. And so I was just wondering, what are your thoughts on that?
Well, so right now I have to say no to that. The way it works in West Virginia is there is the Department of Health and Human Services has been given the power from our legislature, from to make the mandate for what vaccines are required for schools. So that requirement would not happen without DHHR's ruling, and so I haven't heard any discussion on that. I don't know. I think we have to find out how many doses of vaccine will be available, who will be the first ones. I have a feeling that the first people who will be likely on a list to be vaccinated would be healthcare first line responders, healthcare workers, the most vulnerable, which are our elderly, our immunocompromised, and perhaps our infants, because we know that the highest risk in pediatrics is under the age of 1, and then any child who has significant, comorbidity disease. So I think that we'll have to wait and see what happens with the vaccine.
Well, when you're talking about these babies that are being vaccinated, when I was having mine, the vaccinations were a pretty good distance apart, but now they just seem to be putting several vaccinations into these little bodies.
Well, you know what? The amount of number of vaccines has certainly increased since I was a kid, and probably when your children were younger. The actual number of proteins or the substances in a vaccine has gone from several 100,000 to 120. So that means the number of proteins that a child is exposed to in all those vaccines is much lower than what we used to give in one dose of, say, smallpox, or even, the older shots that were given to children. So, and they've very safely been studied in infants. So I think before we give infants a COVID vaccine, they have to be studied in infants. The FDA actually has a ruling that about 10 years ago they said we can no longer grandfather any medicine into pediatrics without studying it into pediatrics. So many antibiotics would be studied in adults, and then we would figure out safely how we could give them in kids. Well, no longer. We can't do that. So anything that's given to children in today's 21st century has to be studied in children in a very scientific manner. So all the current vaccines have been studied and then continue. We have a very active vaccine safety data link system that follows the safety of vaccines. But I agree with you. We would not be doing something certainly in pediatrics unless we knew that we have data and we have safety. And so that takes time. We all want a vaccine yesterday, and yet we can't make it happen too fast, because we just have to follow those rules of it has to work, but it also has to be safe. And that to me, I would never do anything for a child if I didn't know that there was safety there. So that's my opinion on that.
Thank you very much, Dr. Moffett. We only have a few minutes left, so there are a lot of questions in the queue related to internet, and especially with schools having been closed in the second half of the year, and some uncertainty about the upcoming year. I think we're going to be open in West Virginia, and that's the plan. But a lot of questions about internet, and I will just tell you, there's a bunch of questions there. I hear you loud and clear. I hear it everywhere I go. There's been a large phone/internet provider that has been blocking smaller internet providers from going into the rural areas, and then there's a FCC regulation that if it's provided by one of the bigger ones, then they can't give grants to nonprofits to go in there and provide the internet to hook up rural folks. And one of the internet companies is trying to stop the other. So I fired off a letter just a few weeks ago. I sent a letter off to the Federal Communications Commission saying that it's not right that smaller internet providers are being blocked by a bigger one from providing internet. So we are constantly looking for ways, and I always promote HardyNet. HardyNet in Hardy County has a local co-op, and they've provided great internet to that rural county. And if they can do it, we can do it in every county in West Virginia, and that's a model that's been expanding. But I think some of the bigger internet providers don't like that competition, so I think we need to make sure the regulations and the federal government encourages that rather than stops it. So.
Thank you, Congressman Moody. I have many patients who do not have good internet access, and so we've been able to make a breakthrough with being able to do telemedicine visits because of COVID. That's one of the very few positives. We've been able to do that so we can talk to our patients at home when they can't come here. But
Right.
if you don't have internet,
right.
it's a challenge. So thank you for working on that.
You're welcome. And this is bipartisan, Republicans, Democrats, Senator Manchin, Senator Capito, me, and we're fighting for internet, and we're going to continue to do it and expand it, because once folks get the internet, then there's higher quality and there's different ways to do it by satellite.
Well,
and things.
it lowers the disparity. That's a huge disparity if people have it or don't have it.
Absolutely.
And really, really important.
Yep. Well, thank you, Dr. Mott, for joining us. I just wanted to say, everyone on the line, thank you for joining the discussion. If for whatever reason we did not get to address your question, you can visit my website, mooney.house.gov, mooney.house.gov, and to send me a message there, or call my office at 304-925-5964, 304-925-5964. I am incredibly proud of the strength and resilience of our communities in West Virginia. We should all be encouraged by the fact that West Virginians from across our state have done everything they can to support, protect, and stand by one another during this unprecedented time. Again, wash your hands often, scrub with soap and water for at least 20 seconds. If you think you're sick, stay home, clean and disinfect frequently touched objects, refrain from touching your eyes, nose, and mouth. I'll continue to remain in close contact with President Trump's administration and all the relevant federal agencies and at the federal level, working with the state level about the coronavirus response. We'll monitor the situation and keep you informed. The West Virginia Department of Health and Human Resources set up an information hotline for coronavirus concerns. That number is 1-800-887-4304, 1-800-887-4304. Do not hesitate to reach out to them with any questions or concerns you have. Finally, stay current on health updates from your local health officials and the Centers for Disease Control, which is simply cdc.gov. If you want updates from me about the coronavirus and other issues, my newsletter, you can subscribe to that at mooney.house.gov, mooney, mooney.house.gov. The last poll question, again, if you didn't respond to that, 1 for yes, 2 for no, and the question was, do you believe the couple in St. Louis, Missouri, who wielded Second Amendment firearms should be prosecuted for defending their homes from trespassing protesters? 1 if you want to answer yes to that, 2 if you want to answer no to that. They should not be prosecuted for defending their homes. And again, I promise to do what I can in Congress to continue to combat this epidemic and fight to protect you and your family. If you need assistance, the Charleston phone number is 925-5964. Martinsburg is 264-8810. We have staff ready to be helpful to you. Thank you again, and God bless.